always good to be with you. I don't think it's been a year since I came. I did not find my calendar that had my schedule of Polio Plus speeches last year. It's been roughly a year. Woke up, and I simply could not get up. Am I off? Or just...
So you can use the mic.
There. Is that better?
Yeah.
Okay. I woke up and I could not get up. I could not move my legs. I could not move my arms. I couldn't even move my head. So I just cried until my parents came. And soon found myself at Memorial Hospital in Lima, Ohio. And a part of my story was that I heard the doctor tell my parents the day I was admitted to the hospital that there was not one chance in 10,000 that I was ever going to walk again. And so I truly do consider myself to be among the lucky ones who encountered that virus. The polio virus attacks the nervous system. And the way it works, the virus is selective. It's selective about the cells that it attacks, and it attacks cells that are in the nervous system, in the spinal column. And it kills those cells. And what happens then when those cells are gone is that the movement of whatever extremity might have been driven by that nerve cell, that movement is lost. And it cannot be recovered. Sometimes it meant people were paralyzed just in their legs. You will often see, if you see pictures of polio survivors, you will often see people who are able to manage fine with their arms, but they have to have braces or they'll use crutches because their legs just don't work. The worst thing, at least as I think of it, is that some people had the cells that touched their chest muscles and their diaphragm. Those people generally died. A few were kept alive, a relatively small number, although it was a large number. By relationship, it was a small number of people did survive and were in iron lungs that did their breathing for them. We started getting in the business of dealing with polio in Rotary back in 1985. That's when Polio Plus was announced as a program by then President of Rotary International, Carlos Canseco, and went about the business of forming partnerships with different groups and trying to deal with national leaders to begin this eradication effort around the world. At the peak of this epidemic, about 350,000 people a year contracted polio. And that again is a worldwide figure. And it was all over the globe. And one of the things that made Rotary such a good champion for this project is there are places that initially that approach to a foreign government to work to help eradicate polio was not well received. And so the tactic that was used was Rotary Club to Rotary Club. And there were always Rotarians in those other countries who were people who had some influence and who had contacts and made that network begin to work on a truly worldwide basis. There still are problems with some of that communication. I shared some of that with you when I was with you before. Pakistan is one of the two nations where there still are active cases, and a part of the issue that we've had to deal with there, I believe I shared with you when I was here before, rumors circulated in Pakistan that that our medical teams, that it was a medical team that gave away the location of Osama bin Laden and led to his death. And so there was some distrust at that point. I also shared with you that that rumor, as far as I know, is not true. Our people know better than to be involved in the politics locally. They know what the outcome of that can be. In dealing with polio, the thing we have to do is we have to break the chain of its spread. And what that means too is we have to go where it is. And unfortunately, the places where active polio still is occurring are places that are not easy to get to, sometimes because of locale, the geography, the rough geography of the territory, but also because they tend to be in tribal areas where there's animosity to anybody who's an outsider. The two countries that have active cases this year are Pakistan and Afghanistan. Afghanistan, the parts of the country that have had new cases are parts of the country that are basically under the control of the Taliban. And in Afghanistan, it's some of those northern areas in the country where there are tribes hostile to Westerners. But we continue to work with them, and the approach has been to try to deal with local clerics, local clergy, and to get local people to be trained to give the immunity, to give the vaccine. The vaccine is very easy to give. We now use the oral vaccine. I'm sure probably most of you know that, so it's easy to give. And so it's really great when we can find somebody in a village or a region that will take responsibility to do that, and also then to keep records of all those children who have been immunized. Records do have to be kept, not just because we want to know the numbers, want to know that everyone's being reached, but also because it really requires 3 times, receiving the vaccine 3 times to have the immunity develop. Sometimes it's even more. It depends a lot on the nutrition of a child. If they are malnourished, they may need to have more doses than the 3. We are at the point where this year, so far, to date, as of November 21st, worldwide, there are 15 cases. Last year at this time, by this time of the year, there were 34 cases. And so you know, at this point, we've cut that number in half. One of the things that just amazes me when I think about it is I did the math, taking the peak numbers from the years when that worldwide epidemic was the worst. And in the early 1950s, by this time of the year, there would have been over 310,000 cases. So to be talking about 15 cases is pretty nearly a miraculous thing to say. I think being able to say that, though, also can carry with it a caution we need to be aware of. And that caution is to think that, well, it's almost flipped, we can let up now. It's not that easy. First of all, it is estimated by the World Health Organization that there are still about 400 million children who have not received the vaccine. Most of them are in areas where there has not been an active case recently. should something happen, as happened last year in Nigeria, where there had not been any new cases for 2 years, and the virus got reintroduced, then the disease could take off again in a particular region where there have not been the immunizations. Part of my message is we need to take care of the end game. We need to make sure we finish the job. I'm glad to know there are so many Ohio State fans here, because the example that came to my mind was Ohio State and Penn State. You know, you got to win at the end of the game. You've got to have the highest score at the end of the game. We have to finish. Given study of the logistics of the movement of people, for any number of reasons, especially because of armed conflict and refugees, and because of migrant workers from the third world working in the first world, there is risk of a disease spreading from the places where there still are active cases. And the World Health Organization and the U.S. Centers for Disease Control did a projection. Basically what they use, I don't know, I'm old enough, I'm not a gamer on using the technology. I would guess probably most of you are not gamers either. But an electronic game is put together in such a way that it can take the various factors the person playing the game is going to feed into the system, and then it reacts to those factors to select what the next option will be. It's basically a gaming technology that they use to study what would happen if we stop immunizing at this point. And their conclusion was, because of the movements of people, that if we just stopped immunizations today, in 10 years we would be back to 200,000 cases a year. And that in 20 years we would be back to the level of the early 1950s. So it is essential that the job be finished. One of the things that I thought about is, you know, when I had my polio, one of the things that happened at our house, and I'm sure it happened in many victims' houses, was the why question was asked. Why? How does this happen? What causes it? At the time I got polio, they were not even sure it was a virus. There was question about what caused polio. I know for several years, my own dad carried a guilt trip, because one of the theories was that if you got your spine chilled, that would cause polio. And you know, I grew up on a poor farm down in Allen County. Our family had one vehicle. It was a pickup truck. And so I had my mom, my dad, and my little sister, and whenever we went any place, Mom and Dad and my little sister were in the cab, and I rode in the back into the pickup truck. And so my dad was thoroughly convinced for a while, because he bought into that theory about the chilled spine, that he had caused my polio. And I can remember it was almost a little celebration at our house when it was found out that that was not the cause. But still, the question was asked why. And that question would still be asked today, I'm sure, in the homes of those children who contract polio. And when I think about our involvement in the initiative that we have driven through Polio Plus, I think the answer to that in the future is likely to be that people who could finish the job didn't. We did not take care of the end game. And so we have to see it through. Projections from the international polio eradication effort have estimated that it's going to require about $1.5 billion to finish the job. It sounds like a lot of money to me. But you know something? I was amazed. Dave and I went this last June to the convention, the Rotary International Convention down in Atlanta. And we came away from there knowing that $1.2 billion was already pledged to raise the $1.5 billion. Since that time, the United Kingdom has dropped in another, I think, $150-some thousand. So another tenth of a point closer as we think about that figure. I feel very good about the response that we've had in our part of the country. I'm proud to tell you that last year, in terms of money raised, of the 34 Rotary zones around the world, our zone raised more money than any other zone for the eradication of polio. And our zone, together with, help me Dave, we're 29?
We're 29, and Zone 28 is also part of a gathering.
Yeah. And together, we raised over $23 million. To get some perspective on that, our pledge at the convention was that over the next 3 years, Rotary International would raise $150 million over the next 3 years, $50 million a year. And when we look at that figure, you know, our two zones raised almost half of that. And I'm glad for the support we have. I'm glad for the support you have given. I brought some things for your president to pass out to acknowledge some of the giving that you've given. And I don't know that you're going to have time to do that today, but you'll do it sometime. I have been very pleased with the results, the response we've gotten, and the response I've gotten when I've spoken to the various clubs. I think that's really where I would stop and try to answer questions that you might have.
Dwight, one thing that I think people should understand, that we're talking about a lot of money to finish the job, but it's been determined that if we don't finish the job, it will cost 10 times as much as far as the illness and disease that will become prevalent again. So we can't stop now. We can't.
Yeah.
When we lift this, it will be the second time in the history of the world that a disease has been eradicated. We did it with smallpox, and polio is the next thing to go.
Was there any part of the country that seemed to be affected more by polio than other parts? I mean, was it more prevalent in the Midwest or the South or anything else, you know?
I don't know that we could really identify it regionally. The places where it was most prevalent were generally places where there was some issue of there not being good sewage treatment. The virus lives in soil and water and in sewage. And then once it acquires a human host, it spreads through human contact.
I wondered if it could have been anything that could have been basically introduced in the United States after the World Wars, where it was more prevalent maybe back then, if people in some of the places they served could have brought that back to the United States.
Yeah. It was still an occasion of not knowing what caused it. I think this is one of the places where the technology is so valuable today, because you can analyze that kind of thing so easily. Places, because it spreads by human host, there were some places where, well, New York City, if I'm remembering correctly, New York City one year had over 6,000 cases. Where there was dense population, that could also happen. Today, one of the things we would be concerned about when we look at places like Afghanistan and Pakistan is, where is their sewage treatment? And that then gets into the water, and rivers cross borders. So some of the countries that we've declared polio-free could be reinfected very easily. There is a limit. I mean, one of the concerns I had was some of these areas where polio has been active, we've had military personnel going in there and coming back.
That's why I asked the question.
Two things that I found out in checking, though. One is that the virus out of its natural environment will only last about 2 to 3 weeks, max. And also, the military is pretty aware. And so things like the treads of vehicles and that sort of thing really get cleaned up when they come from one of those parts of the world.
We used to call it infantile paralysis.
Right.
Are the children more susceptible than adults?
Small children are the most susceptible. Yeah. And I don't know if everybody heard, it was called, really, it was called that when I got it, infantile paralysis. It will affect adults, but it's primarily children.
Dwight, something to kind of bring it home is back in the early 50s when we had a really big problem with polio, Hicksville and Northwest Ohio were heavily hit.
Yeah.
This small community had 30 plus active cases at one time. It's just a frightening thing to think. It can happen.
With mobility of people, I mean, the only thing that needs to happen is for somebody to be in a place where they can contract or carry the virus. Then, at the rate people can move today, it can be introduced someplace else because that human being is a carrier at that point.
Yeah, I did first that. I remember hearing that you typically need to be treated more than one time. So evidently they're going back in a lot of these countries and doing it over and over. I haven't heard of anybody being treated or receiving a vaccine in the United States. I mean, probably they do then, maybe, I don't know, but I don't.
I think as just a matter of course, in the U.S., you do get the polio vaccine.
It is one of the childhood
Right.
inoculations.
But it's probably one time though, isn't it, or not?
Yeah. One of the concerns today, though, caused me to think about this. We have in recent years had a number of people that they're called anti-vaxxers that do not vaccinate their children. And that's a concern not only because their children could be infected, but also because if they were infected, they could carry that infection to another place.
Some years ago, I think in the 50s, we had a basketball star here in Hicksville. I think his name was Todd Cool. Was it
Bill.
Todd Cool?
Bill.
And within 3 days, it hit him and he was gone.
Yeah.
And he was the last person in the Hicksville you would expect to die from polio or infantile paralysis at that time. It was so quick.
Well, and what was the fooler about that is it had nothing to do with muscular development, physique. The disease attacks the nerve cells. And it doesn't care whether that's a well-developed muscle that's driving your breathing or whether it's not. It kills the impulse, so it can't work.
In this particular case, his grandson, Jim Tomachek, had polio. He got polio, if you remember that.
Every club I spoke to last year, there was at least one person who had a family member who had had polio. and probably on the average, 6 or 7 people who knew people who had the polio. Yeah, there are 2 of us in the Bryan Club that had polio.
Dwight, I looked up to see about the polio vaccine. Here in the U.S., they say most people get a polio vaccine when they are children. They get 4 doses at the ages of 2 months, 4 months, 6 to 18 months, and a booster dose at 4 to 6 years.
I did know there was a booster. I did not realize there were. Thank you. If any of you want to talk or ask a question, I'll hang around for a little bit.
Larry gave me our total, so since we've been passing the pig, not the pig today, but the pig, we've raised $193 for polio. The club will be matching it, so that becomes $386. And then Bill and Melinda Gates Foundation is also, it's a 2-to-1 match, I believe. So what small amounts that, we've individually been able to donate, it's it multiplies very nicely.
Now, I should have mentioned collectively that $150 million pledge that we made, Bill and Melinda Gates pledged to continue to meet that entire $150 million 2-to-1.